Thank you.
Ma'am, we miss you so much, ma'am.
I'm also missing you all.
Why I wanted to do this meeting today was that I have three important agendas to be discussed today. So this is the idea what I wanted to do. I thought like some progress we have made in 2019, 2020, 2021. But I want to take urogynecology to another height starting from this year. And I think things look like their opportunities are coming our way and they will be fool not to grab it, okay? First, let me tell you one thing which I have made clear in my mind. Whenever I say urogynecology, that does not mean that we are focusing a class of group or a group of people who just want to take urogynecology as their career. That is not the aim at all. So I think we need three kind of people right now, three group of people. First group who want to pursue urogynecology as their future in gynecology as a subdivision of it, who want to practice urogynecology, who want to teach urogynecology, who want to just remain restricted to this field. That is one group that has its own advantages and disadvantages. The other group of people I want to target is who will be doing private practice or who will be going to any medical college also, where anyway you have to do everything. Everywhere the division is not very clear, when you will be doing everything as an obstetrician and gynecologist. But yes, your part, that part includes when a urogynecology patient comes, once a lady comes with SUI, you cannot say that I don't know how to treat her, okay? When a simple case of prolapse comes, you cannot say that no, I don't know how to do a good vaginal hysterectomy. And when the patient comes for follow-up, you are scared that I don't know how my results are because I'm not the pro in that. So I want to, like anybody who is a gynecologist has the freedom to do laparoscopy, has the freedom to do infertility. That group should learn something, some part of urogynecology also. So that is the second group. And when you are PG, maybe little orientation you get for other subjects, but it is very difficult to get a focused kind of teaching for urogynecology in most of the institutions. So my aim is to strengthen that group also, whose idea is not to become solely a urogynecologist, but they want to learn things, basics of urogynecology, so that they can apply in their private practice or in their practice for that matter. So I feel that as a gynecologist, you should know little bit of everything and then you can specialize in one of the branches. So the second idea is that. The third group is that for those people who are definitely my age group or maybe elder to me, who are actually seeing in their routine practice, they are doing this practice of urogynecology as their day-to-day practice. But sometimes because nobody has taught them, they are self-learned person, and in that phase of life you cannot every time go and get evidence. Sometimes you are too busy to get it, sometimes you do not know where to find out. So they already are doing, but in 10 years, 15 years, they have realized like this kind of problem they are not able to solve. For example, they are doing routinely vaginal hysterectomy, but they find that their recurrence rate is quite high. Why it is happening? Or they are usually doing a tension-free vaginal tape procedure, but in many patients they found that there were complications. They don't know how to manage or how to minimize or how to prevent those complications. So that's the third group I want to target. So what we are going to target this in 2022 is a broad area, starting from those students who just want to be pro in urogynecology, want to take it as their career. Second thing, who want to do everything. They have not yet decided finally what they want to do, but they want to learn um, a little bit of urogynecology also, so that they can become a good gynecologist. Third, who are already doing it, but they want to know little more. They want to know how to manage complication, or if they are doing 60%, they want to reach the platform of 90%. So this is the target audience for this year 2022. Now for this year, I have three things in my mind which I want to do. First, this is the conference. This is mug part 3, but I want to discuss more about it with all of you. And then one weekend online course. Some of you know that since last 2-3 months I have been working on this to how to start an online course. And the third thing is one year fellowship, because now in Manipal itself we have for many specialities in various departments, they are very encouraging to start 1 year fellowship. So I want to think about it. I will tell what was my reservations and why I'm thinking to do it now. So first thing is this conference 2020, we did physical online conference, which I don't think we enjoyed a lot. Okay. And the second conference 2021, because it was such a not a very good taste in our mouth, so we thought that we will not do. But now 2022, I want to do it again. I want to give it another chance. Okay. And we want to bring back the magic what we created in 2019 with the same view, but little changes. So with you all, I want to discuss some of the first thing is the date. Okay. So I'll tell you my idea. I thought I want to keep it on 16th of April. Okay. Why 16th of April I chose? Because first thing, by that time I think COVID would be dead. Okay, I hope so. The fourth wave would not have come and this wave would have gone. So it will be a safe period in March, April sort of thing. The other important thing is that this batch, Vaishnavi's batch, which is with us, most in all probabilities they would have done with Snehita and Vaishnavi's batch, they would have done with their exams, okay, by say middle of 16. We will not be able to use them for preparation, but four or five of them who are very important, who have been a part of MUC since its inception. So I think those people can come and be a part of, like suppose their exams are finishing on 12th, they can still plan to stay 3-4 more days, because if their exams are finishing on 12th, I cannot tell them to wait till 30th. So that is the reason for those 4 and 5 special people I have decided this date. Okay. So new juniors are also coming in February most probably. So we will have, because we know we need working hands also. Okay. So that is also one of the requirements. So we want to, so what do you think about this date? I'm ready for all negative, because most of the times negative arguments work better. Let's decide the date first.
I think April is perfect.
I feel April is perfect.
It is okay?
Unless COVID comes in or something really drastic happens, which hopefully wouldn't.
I
If
know.
nothing like that happens, April is good.
April is good. And we have to be ready. See, everything now, so many things, even AICOG Indore, everything was ready. So I think in future, till this COVID is dead or it becomes just a part of it, we have to be ready that even on 1st of April, we might have to cancel it.
Yeah.
So first you all guys have to confirm that you all are coming on 16th, then we'll do it.
Hello, I'm good, ma'am. Little busy.
Little busy, okay. So till whenever you can be with us. So
Yes,
leave,
ma'am.
and whenever you have to go, that's okay, fine. Okay.
Yeah,
I'm
yes.
happy that all of
Yes.
you could come on a holiday.
April is good, madam.
April is good, no?
And in even climate-wise, Manipal, there won't be rains in
Yes,
April.
yes.
After that, it will be, I think, rains also will disturb.
Yes. So let's keep this date for 16th. Okay, 16th for us,
Yes.
it is very good because it is a third Saturday. We are still enjoying our third Saturdays. Okay. Now the second question is, if all of you agree with 16th ka date, now my second question is more important, whether it should be 1 day event or it should be a 2-day event. Okay.
2 days.
2 days.
2 days.
2 days.
Okay.
2 days will do, ma'am.
Okay.
2 days.
Like before, madam, workshop one day and next day will be conference day.
Done then. My only thing was why I wanted to say, because some people, if they are coming from nearby places like Mangalore, they can just come and go. But if we make it very interesting, maybe they can come 2 days also and go. Okay?
Now,
So
if
2
we
days.
give it 2 days, like people can come whatever day they like. Also.
Yes, yes.
Like otherwise it will be like 1 day and then
Okay, so all of you agree for 2 days?
Yes, ma'am.
Okay.
Yes, ma'am.
Okay.
Yes, ma'am.
Okay, so 2 days we are going. As Prandeep said that 1 day we'll keep workshop, like last time also we did some hands-on workshop, and then I'll tell you what are the things in my mind for that. And second day we'll do OT as well as this kind of thing, lectures and OT interspersed and some games or all that thing will decide. Okay. Now the third thing is program theme. So first time when we did basics of urogynecology, everything we included. Second workshop when we did, we included only prolapse as the broad topic. So do you think a theme based approach is better, or it should be covering everything? Because I thought the theme for this year can be only urinary incontinence, which includes VVF, which includes SUI, which includes urge incontinence, neurogenic bladder. Because if we divide this also, there is so much to learn. So what does your say? Theme based?
Theme based will go.
Theme based. Okay. So Vritti, Chandana, theme based. Prandeep and Richa?
Yes, madam. That will be very good, madam, actually. And in each case, you can separately present by, like somebody can present each and every case, and the treatment part also you can show in the surgery like before, how we divided and did.
So things what we can do, we can keep it entirely theme based. So first day we'll teach them TOT and TVTO in models, we'll try to arrange it, and second day then they learn, then they know what problems they were doing. So I think it will be a quite a nice thing to do for 2 days. Okay, so one very important thing, registration fee, I will come to it later, but one thing is in my mind, that those who are traveling, all of you who all are traveling, I want you to come as faculty. Okay, so we'll plan things like Suvriti, Chandana, Richa, Prandeep, all those, and even if Harshita and other people, I thought they will join today. Depending on how many of you are coming, I want you to be as a faculty so that other people also know that you are involved in this field. Okay, so we have to plan what activities we can do. Some ideas I'll give you, that we can do a panel discussion also. Then we can do something like round tables. Okay, like we give one case, we choose, like usually how we do in 3D, Richa, that we divide them based on some funny thing. We can have, like at the entrance, we can have 3 colored toffees, okay, candies like pink, red and green. So people will randomly pick up, and those people who pick red ones, they become one group. So that will be totally a random selection. And those who pick green color, they become one group. They sit in one group. Then suppose Suvriti is mentor of one table and she gets a case scenario. Then they have discussion with that case scenario. And at the end of it, like after half an hour, you presented how your thought process went and how the cases. So everybody learns 3 different cases or 5 different cases. So are you okay with this thought? Are you excited with this thought that all of you will be as faculty, and we'll give you faculty certificate and we'll treat you as faculty? Whatever college can do, like I'll ask them if they can give you nice accommodation as faculty, we'll try to get you that.
So it does like organizing team only.
No, organizing. See, like I am also faculty, you are also faculty, all of us are faculty. Okay, so you'll have to decide what all activities we can accommodate and to do these kind of things which are innovative and interesting also. Okay, then one thing now, I want to keep some registration fee. All of you are aware that that day, first time when we did, because of some reasons we could not take any registration fee, but I have three things why I want to keep the registration fee. First thing, when you pay some amount, that means you're sure of doing that, then only you are committed. Okay, otherwise everybody registers. That time also same thing happened, around 200 people registered and we had only 50% crowd. When you take out 1,000 rupees from your pocket, then you feel like attending the program, not wasting it. So it shows your dedication. Okay, that is one thing. So if anybody comes and they say that we want to promote our brand and we want to put a poster and we want to give that much money, it's okay to do that. We will not say no to them. So tell me, what do you think would be a cool registration fee from your end? What do you think, Richa?
It will be the same for both online and physical, ma'am?
We are not doing it online. Physical.
Oh, not at all?
No, this also I will discuss at the end. Hybrid, do you want to do?
What I think is maybe some of the sessions which we feel like last time we could broadcast very smoothly, right? The 2019 conference.
Okay.
So some of the things that we feel, say for example, a panel discussion or something, or maybe the surgeries, which we feel that actually it is something that we can do on a larger scale, we should. So what we can do there is that maybe for that segment, wherein we can do an online thing as well.
Okay.
We can have a separate registration fee, which can be a little subsidized.
Okay.
And then for the physical thing, we can have a slightly higher fee.
Okay. Okay. So
those physical attendees are going to attend the entire thing.
Okay.
Whereas we probably won't be able to broadcast the whole thing online because that is a little bit of a hassle anyway.
Yes. Yes. I was not thinking this online, but we have written it down. That's a good idea. That part of it we can relay. Okay. Like I was thinking 2,000 from all the delegates and 1,000 from students. Fee.
No, that's very less.
Is
I
it?
know. Around
Yes,
4,000.
fair enough.
Yeah, that's really less, ma'am.
Is it?
We can have a separate section for these paper presentations.
Paper
and divide it into
Actually,
categories
no,
like
if
award
you remember,
paper.
Richa, last time we had kept this because of this, but
Yes,
not even
But
one
not
paper.
many entries came.
Hardly anything
Now,
came.
we advertise as much. Now, this time what we do is we start advertising from now. And people are
yes,
You are writing it down, no? Paper poster session. Okay, we can keep it. So
Yeah, paper
Ma'am,
We can
one
keep,
thing
ma'am,
like,
like,
this one.
now there are many theses and also are there on urogynecology. Many, like in every college they have 1 or 2 theses on urogynecology.
Okay.
And they can come into that.
Ma'am, even that thing, you remember that idea thing that we came up with last time?
that is
That's
coming.
an idea.
That is one thing. Last I'll come
So
with
for
that.
that,
Okay.
we will have participation. Now,
Huh.
students will not have any sponsorship, so they will pay whatever.
Huh.
So I feel like we can keep say around 2 to 3K for the online thing and 5K or something at least for physical.
5K.
So I thought we will not call many. First is national faculty versus international faculty, but I have been thinking about it for last 5-7 days. I thought like last time we were planning to call 3 international faculties. I think that we should not do. Like first time we did, we'll call 1 international faculty, but who is really good.
A lot of conferences have this thing, right? When they have these hands-on workshops, those are separately
Okay.
charged.
That is what I'm
Yeah.
Yes, yes.
Separate,
They're separately charged.
Okay.
So if they want that, they're separately charged.
Okay, so we'll discuss this workshop fee. Now we are going to have 3-4 kind of fees. One is for workshop. Okay, maybe some people just want to do workshop. I think we should leave scope for that also. One is a conference delegate fee, one is conference student fee, and one is online fee. So now tell me, the least amount of this fee will be for those who are for online. But standard, let's see for delegate conference fee, how much should it be?
And there should be, I think, one more category when somebody wants to come both for the conference plus the hands-on workshop.
Hands-on workshop, okay.
That workshop will be charged separately. No, Baba.
Separately, but
No, I
we
think
can
it's
give some
included.
concession.
amount for
Yes, so then they have a
Plus the
little more
conference.
for this thing.
No,
I'll tell you, if online is being charged 1,000, say for example, sorry, if a workshop is being charged, say for example, 1,000, just an example, and like if they're physically attending the conference as a delegate, they'll be charged 1,000. Together will be 2,000, right? If you're paying separately. So instead of that, you can keep another option where together it's going to be 1,750 rather than making it 2,000.
Yes, that's
Oh,
it.
yeah.
Yeah.
Those are people who decided beforehand ki acha, we will do the workshop.
Yes.
Very nice.
I think that should be around 2,000.
2,000, no?
Yes.
Or we can do one
2,000.
thing. We can do 2,000 if you do till March, for 15th March.
early bird
After the
category.
early bird kind of thing, after that 2,500. Is it okay?
Yes.
ma'am.
Yes.
For students now, based on this, you tell me student
Students should be 1,000.
1,000 only.
Half mark.
Student 1,000.
1,000,
So
1,500.
we can do for them. A workshop we'll decide later based on what kind of workshop we are doing. So this is done. So date is done, 1 day versus 2 days done. Program theme we have decided. Conduct we have to sit and do it again. Registration fee we have decided. Faculty, so I want to call only one international faculty and is in my mind. All of you agree with that?
Yes, ma'am.
Yes.
Or anybody wants to call anyone else? Then next interesting thing is about dinner. So first time when we did in 2019, it was totally an experiment. We kept 1 day dinner for 2 day conference. So if you all promise that you will come one day before, like Saturday, we can have Saturday. If you are coming for Saturday, Sunday 16th night, we can have a nice party dinner. Or I'll give you 2-3 options. Tell me one thing. We can have one dinner on Saturday which will be open for everybody, and we can have one dinner on Friday which will only be for the faculty members, like all of you are faculty and special group who has come. One nice dinner we can have on Friday. The other option is for dinner.
I think we should do it post conference, like as a celebratory thing.
Okay, that is also a good idea. But, then you have to come.
Yeah, ma'am, even I think post.
And we should include all the delegates also. Because I don't think so. Like it will be not many people, ma'am. So it will be like not a very big gathering.
Or Richa, what we can do, we can like Saturday, Sunday. Suppose if we are having 2 days, people would have come on Saturday. We can have a dinner with everybody on Saturday night, and for all of us who are going to stay on Sunday.
Because some people tend to leave after the conference is over.
Yes.
So they won't come.
Ma'am, I would like to say something.
Yeah, tell me please.
I think the second option that you were saying, that initially on the Saturday night we'll have a dinner with all the delegates in a combined dinner, like how we had.
This is
Harshita. Thing only, basically.
Harshita?
The dinner wala thing that you were telling, कि हम लोग एक दिन previous day we'll have everything with including delegates and faculties, and then we can have, how Subriti was suggesting, a celebratory one with just the organizing team, how we had thought before. So even the delegates and everyone will have an introduction to what is the event about, and they'll warm up a bit, because 2019 when we did it, so we came to know about the delegates. हम लोग काफी warm up हो गए थे by the time the session had started the next day. So I think it would be a good idea.
Okay. So sounds good to all of you. Subriti?
Yes, ma'am, completely.
Chandana? Good?
Yes.
Richa? All? Sanjana? Kriti? Everything?
Yes, ma'am.
Okay,
Yes,
no?
ma'am.
This plan is okay? Now the question is inclusion of other specialty. Initially we kept always as gynecology. But what I feel now, because of YouTube channel, there is a growing interest for our specialty among urologists, among physiotherapists. So should we include them also as a part of conference? Because if we include them, we have to keep some topics, some things related to them also. Do you think inclusion of some kind of physiotherapy, simple physiotherapy,
Yes,
will be
ma'am,
good?
definitely.
No?
Physiotherapy, I think we should.
We should. So this is done. We'll keep one session of, and maybe when we are having workshop, we can have a separate one station for physiotherapy also. Physiotherapist, or if we are interested, we can just go there and learn some exercises, practical exercises. We can have model and some training small.
They can give something like a read-through paper for everyone.
Yes, yeah. They can give us pamphlets also, which even we can distribute to one for preventive urogynecology. But this is one motto I want to have for this family. What you are saying is perfectly, I understand what you are saying, totally correct. But somehow I want to change this mentality from, at least from our group. I think when we teach each other, we grow. Like if I tell 2 tricks for this has been a major drawback in gynecological surgeries. I think people who knew, they never transferred their knowledge. Like I think one generation ago, among the gynecologists also, there were very good gynecological surgeons who were good in gynecological surgeries. But people did not transfer their tips and tricks, and ultimately we are all going to die. Okay. And what I have felt that the more I teach, the more I learn.
Not a gynecology delegate or a urology delegate, it's a delegate. Conference delegate.
So who is going to conclude this discussion? Harshita, I want to conclude what all we discussed in last 10 minutes. Conclude it. What are we going to do? Vaishnavi is making notes.
Yes.
I just want to compliment you. You are looking very pretty despite COVID.
Thank you, ma'am.
So this is also done. Meanwhile, I want to introduce Vivel. She has finally joined it. Vivel is our new senior resident.
Hi, Richa ma'am.
Hi, Vivel. How are you?
Okay, so if you don't know, she is our senior resident now. Dedicated. This here, Vivel's role is very important, because I know that all of you will be supporting offline, But to run some errands here, we need a dedicated in-house team, especially who can look after accounts, who can look after registrations. So we will, I cannot include their batch, Vaishnavi's batch, because there will be exam going. But I want Vivel to take this. Vivel and Sunaya also I wanted to join.
Okay.
She joined initially.
Yes.
So all of you, Suvriti, Chandana, I want all of you to come 2 to 3 days before only, so that we can
And only next door.
Okay, Suvriti, you will also come before. Harshita, what about you? Richa, Harshita.
I might try. I'll let you know by this month, and I'll by mid-Feb I'll confirm.
Okay.
If I'm able to do, I'll definitely come early on. 2 to 3 days
Suvriti,
earlier.
you also keep 1 or 2. You also apply leave now only before, so that you
Yes.
can have. I'm not sure that if all of you come, how much will work and how much will party, but still. Okay. 1 or 2 days before also, if you can come, I think that will be very nice for organizing things here. At least you can guide the juniors how to go about it. Okay. So this in-house team I want, and online team I'm sure all of you are going to support. Now what Suvriti was telling in between, that is one of my things, that innovation. I don't know how much you are oriented to this thing called innovation, but I want to just give you an idea that, like, initially if you go 100 years back in medicine was practiced totally differently. There was one doctor and all patient understood or listened to or took the advice whatever you said. Ritvika is being blocked by this flower. I want to keep it there. Okay, then the things changed. People said that if you want to discriminate a routine doctor from a good doctor, we started seeing the publications, research world, what kind of research you were involved, and that became one of the prerequisites for people, especially who are working in medical colleges. And also, if you have to say that, okay, these are the group of people, even in private practice, if you have to differentiate in the academic platforms, those people were taken little with superiority who had research and publications. But I don't know whether you are aware with this new world or not. Soon the research is also going to be die, because it has already reached its saturation, and so many things are being antagonized, because most of the journals are paid journals and researchers are not that ethical, and sometimes by the time you publish your research the data is already old. So there are so many things, but the new thing which is going to come, especially India is totally up for this now. It is the field of innovation in medical technology and medical devices. So what was happening, it's not a new field, but most of the time till now, innovations even in medical technologies were done by IITians and these engineering students. But if you see, no engineer can make a medical discovery or medical innovation with a constant support by a doctor. So what was happening, so what I want to tell you, not many people know about this, but I want you all to be oriented with this thing also. So let Merck be the first group to get 10 devices from India. And in urogynecology, it is so important because the science only is so new and the surgeries are so difficult. Because in 2 years journey, I have learned what are the hiccups, what are the advantages, where we can help. So I want you all, who all are interested, to bring this thought also in your practice, in your mind, so that, because we are the people who are working on ground and we'll understand where we need it, and we'll have the ideas. So what I want to tell you, that last time with Suvriti and all, we have discussed one innovation hour, where we want you to present your ideas, okay? And then as a team, we can work to take these ideas forward. Okay, so one idea was to orient you to all these things, and if you are interested, let me know how interested you are. For medical college people who are going to get associated, I think it is a jackpot if you get into it, because so I think it is a good area. We can start some kind of innovation hour. Suvriti, are you there?
Yes, ma'am.
So can you revisit what we had planned in 2020 conference, which we could not? Do you remember something?
We had thought this only that that time, ma'am, we had thought that you would be there, one international faculty would be there, and one more person would be the judge of these. I mean, 3 people would be the judge, and people would be presenting their ideas, and it could be in any way, like either they could give an oral presentation or probably say a PowerPoint presentation, however they want to propose the idea. Okay. And then we would be judging on the basis of feasibility. Like, we actually thought that we'll have a question and answer kind of a thing where we say, okay, what is the idea? What is the feasibility? How do you plan on taking this forward? And then seeing that which one actually seems pretty workable, we would decide who would be the winner. And then I'm not sure, we thought that if at all we could probably help forward the idea in some way, we would.
So do you think we should keep 1 hour for this innovation hour in the conference? They can make groups of their own choice, discuss the idea, and just have a preliminary presentation. What do you think?
Why not? Or we could also keep it like we could advertise it beforehand, and people can come up with things in the meantime also. Like, need not discuss then and there and come up with it. They could come up with ideas from back home and just present it. Like, it can be either way. Innovation hour, like we will do, it can be an individual entry or a group entry, and it will be a competition which will be the same for all. And then people can decide. They can come up with ideas that they have like they have with themselves, not something that they came up with during the course of the conference. Or they could be, say, a group of people that, suddenly had like a brainstorming session and then suddenly they came up with something. Why not?
Yes.
At the end of it, we want an idea. How they came up with it is their problem.
Yes.
How are we going to take that idea forward? Like, because ma'am, we have, like, if we are judging, suppose 10 people, they are coming with something new or some idea they have for some research or for some, like, this patent or something. We have to, like, if we are judging one of them, we are maybe we can give a prize or we can take it forward, like we can help them out. Yes. I think they would have to get prepared beforehand if they are to present in the conference.
Ma'am, everybody doesn't know what innovation means from in medical field. Like, example, I got to know what innovation means just now. So probably I will think about it. So when we are introducing them,
maybe suppose 200 people are attending, or out of them 10 of them, if they are presenting, the rest of them will know, no? But those 10 of them...
But they'll get to know that day, no, ma'am. They won't know prior.
That's what, no? We'll put it in
So we don't want many...
the brochure we can mention, I think.
Yeah, brochure we are supposed to mention what innovation...
Yeah, we can highlight our USP. Yeah, it could be our USP of the conference that we'll be having some new something like
we need to explain that
highlight in the brochure itself.
And if we actually have, if not, we can call it the innovation hour. We should not limit it to that much time, because depending on how much participation we are getting, we can probably do it on both the days and then come up with the
What
I think, if I can speak?
Yeah, sure.
I believe innovation is something which comes from inside. When you see something, you get inspired and then you do. So let our program be that inspiring for other people.
Swati.
And let them come with an innovations.
Hello Swati, where are you?
45 morning, Scotland.
Morning.
Hi ma'am, if you can see me.
So first let me ask you one thing. See, we cannot have too many extra events in 2-day conference, okay? I think we can just remove quiz at all from this part, because we are having paper poster session. So quiz, let's not have quiz.
So ma'am, instead of that quiz, we can have this innovation hour, and then whatever ideas they have, we can promote one of the idea whatever way we can.
Yes, we will not send that person for urogynecology. We'll send that person to KGMC or IIT Kanpur for 2 days.
Yes.
Beautiful.
No, that's better. So
because our fellowship is gonna be very, very profound. Like, it's an important thing.
Yeah.
You cannot
any
idea cannot might not be the same.
Yes.
Idea might be something different.
And
which
that
we can just grab it during the
said what you
conference.
were saying only. I said that only, that we should not send them for the fellowship.
Yes.
Okay, you were saying the same.
Yes.
It's okay then.
Okay, so what we'll do, that person will give them some cash prize, and to learn more if their idea is really good, because they have to, there is no fun in going to the clinical place. We can send them for 1 week maybe to IIT Kanpur as well as KGMC. That I can organize.
That will be lovely as a reward as well. It will be lovely.
That's a good opportunity. Later they can think, if they like the thing, they can apply for fellowship or something.
Yeah, we can publicize it beforehand on a brochure or whatever. That is very good. That is very good because most of the people will not have this concept in their brain, because normally most of the conferences only talk about about the quiz and everything. So it will be good to
let Mug be the first group who introduces it to all the doctors.
And most of them won't know about this. Like, we also are capable of it. So when we promote it, we can tell them that if you have any ideas, such ideas, come, this will be the platform for you to experiment, to see. Doesn't mean that you have to be 100% confident.
Yes.
At least they'll have some idea in their mind before coming to a conference.
Yes, yes.
And we need to explain that in the brochure.
And what I was thinking, like, and now we have a good platform also. In our YouTube also we can make a video. Like last year I made a video about thesis topics. Like that, what innovation is. You know, we can.
I really like those videos.
So we can make actually before conference, related to conference, to explain, understand about innovation.
We can give that in the
promotion. Brochure also, that please visit this YouTube channel and subscribe.
Okay. So the date is decided. The courses are decided.
I think everything. So please see this list. It is on your screen, I hope. So please see. If you have any question, then we'll move on to the other topic.
Ma'am, who all are gonna help you in this, like being physically there beside the postgraduates? Because Richa ma'am, Prandeep sir, Kirti ma'am, me, all of us are out.
Yes, all of us, all of you are out, but you have to be all the time helping us offline.
Ma'am, that will be there, but that running business, both of us know, ma'am, how much it is.
I know. So this time we have Vivil. Vivil is our senior resident, and Sunaya, you know.
Alright.
Sunaya, both.
Sunaya is good.
And I hope we'll have all the support from our HOD. So, Sunaya and Vivil, are you there?
Ma'am. Yes, ma'am.
Okay.
Ma'am? Yes, sure.
If we have more hands, it is always better, because there are so many things which crop up on that day, like for organizing. So you can pass on the message among the new juniors who have, if they want to be a part of the team, they are more than invited to join us. Okay, so that also you are writing. Okay, so can we move on to the another topic for this year?
Yes, ma'am.